Minister, I want to welcome this bill that provides for certain exemptions for charges for acute patient services, in particular to provide an exemption from such charges for children less than 16 years of age in all public hospitals and for persons who have chosen to avail of private acute inpatient services. This legislation, when enacted, will ease the financial burden of parents, guardians when bringing their child to hospital for inpatient care, and will help to ensure that cost is not a significant consideration when children require access to inpatient treatment. And I know, Minister, again, you also have received government approval to bring a committee stage amendment to the bill, which will insert provision to provide for the free contraceptive scheme for women aged 17 to 25. The proposed contraception amendment aims to remove cost barriers to contraception for women aged 17 to 25, which will be particularly significant for those who are just above the means-tested limits for medical and GP visit cards, or who may still be in full-time education and financially dependent on parents and guardians. Currently, public patients, including children, are subject to the statutory public patient charge of €80 per night, up to a maximum of 10 nights, which is €800 a year. So medical card holders and other certain persons are exempt from these charges, and the bill will remove this statutory acute public inpatient charge. And you know, Minister, I really do want to welcome this, and also in doing so that this bill will try to ease the financial burden of the parents and guardians, particularly, you know, for a child to go into hospital, or, you know, and that is so important. But you know, Minister, again, I just have a lot of concerns, and we're speaking a lot today about medical cards, and you know, recently again, and I know COVID has been extremely hard for people, and particularly for older people. And I find in the last few months the amount of people that have come into my clinics, you know, asking about hospital appointments, and they're waiting so long for them, and they all mainly are medical card holders. And again, I had the issue again recently of a lot of older people coming into my office, and some doctors again are charging for bloods. And you know, Minister, with the cost of living and everything now, I find that everybody is finding it hard to make ends meet. And I think when it comes then to extras, whether it's for bloods or whether it's for other, like particularly for bloods or other maybe medication that they need, it's becoming a very serious issue for me. And I know you brought up there the dentists, and I did welcome the fact that you have put, I think you said 10 million into this particular area. But I again, Minister, have had several phone calls from people in County Carlow telling me that their dentist is not taking a medical card. And you know, Minister, my concern is that people who have medical cards, there's a reason that they have them. I think it is important that they get the treatment that they deserve. And I would ask you that we try and sort this issue out, because it's very hard if you have a pain in your tooth, or if you have to maybe have a filling, and you're not in a position to actually pay for it. And then the dentist says, look, I'm sorry, I'm not covering medical cards. And Minister, that to me has been one of the most, I'd say, serious issues in the last few months that I have been trying to work with people on. So I would ask you, Minister, that we address these issues. I would ask that we try and do something as soon as possible. I don't know, again, if more funding has to go into this area. I would ask you, if it does, that it needs to be sorted. We have to make sure that the most vulnerable people in our society have access to doctors and to dentists, and that they are not forgotten. Thank you.